When is a bladder biopsy necessary? Have you ever wondered when a bladder biopsy is needed? This medical procedure involves taking a small sample of bladder tissue for examination. It is primarily used to diagnose or evaluate issues in the bladder lining, especially when there is a concern about bladder cancer or other serious conditions. A bladder biopsy is often necessary when there is a suspicion of bladder cancer. If a patient experiences symptoms like blood in the urine, frequent urination, or painful urination that do not improve with standard treatments, a biopsy may be required. Typically, this follows initial tests like urine analysis and cystoscopy, where a camera is inserted into the bladder to check for suspicious lesions or tumors. The biopsy helps confirm the presence of cancer cells and is crucial for determining the type and stage of any cancer, which is essential for effective treatment planning. Another reason for a bladder biopsy is the evaluation of abnormal lesions found during cystoscopy. If doctors see unusual areas such as tumors or inflamed patches, they may take a biopsy to find out what is causing these abnormalities. This can help identify cancer, precancerous changes, or other inflammatory or infectious conditions. If a patient has persistent bladder symptoms that remains unexplained after other tests, a biopsy may also be performed. Symptoms like chronic bladder pain, urgency, or frequency can sometimes point to rare conditions such as interstitial cystitis or damage from medications. A biopsy can help rule out these conditions and guide appropriate management. For patients with a history of bladder cancer, biopsies may be repeated during follow-up cystoscopies. This helps detect any recurrence or progression of the disease over time. Sometimes, imaging studies like computed tomography or magnetic resonance imaging and urine tests may not provide enough information to diagnose bladder issues definitively. A biopsy is the gold standard for diagnosis, providing tissue confirmation that is often necessary for accurate assessment. In summary, a bladder biopsy is necessary when there are clinical indications of abnormal bladder tissue that requiring further examination. If you are experiencing symptoms related to bladder health, it is important to consult a healthcare professional, typically a urologist, who can evaluate your situation and determine if a biopsy is warranted. This ensures you receive timely diagnosis and treatment aligned with current medical standards.